අද උත්සවයේ ආරම්භ වන්නේ Act2Prevent නිල වශයෙන් දියත් කිරීමයි. මෙම වැඩසටහන මාස ගණනක වෙහෙස මහන්සි වී කැපවීමෙන් සහ සහයෝගීතාවයේ ප්‍රතිඵලයක් වන අතර අද එය ඔබ සැමට ඉදිරිපත් කිරීමට ලැබීම ගැන අපි සතුටු වෙනවා. ඊළඟට මේ ගැන කතා කිරීමට මම ආරාධනා කරන්නේ ADT ව්‍යාපෘති කළමනාකරු රහන්ත අබේගෝන් මහතාට.
The aim of today's event is to officially launch Act2Prevent. This program is a result of months of hard work, dedication and collaboration, and we are thrilled to present it to you all today. I would like to invite Mr. Rahanta Bekon, the Project Manager, Alliance Development Trust, to address the audience.
இன்றைய நிகழ்வின் நோக்கம் Act2Prevent அதிகாரப்பூர்வமாக தொடங்குவதாகும். இந்த திட்டத்தில் பல மாத கடின உழைப்பு, அர்ப்பணிப்பு மற்றும் ஒத்துழைப்பின் விளைவாகும். இதை இன்று உங்கள் அனைவருக்கும் வழங்குவதில் நாங்கள் மிஸ்டர் ரஹாந்தவை மடக்கி அழைக்கின்றோம்.
Members of the Ministry of Health, Secretary of the Health Ministry, Dr. P.G. Mahipala, Director General, Dr. Asela Gunawardana, Deputy Director General, Dr. S.M. Arnold, Anti-Leprosy Campaign Director, Dr. Nirupa Pallevatta, Community Consultant Physician of the Anti-Leprosy Campaign, Dr. Dilini Vijayasekara, former Anti-Leprosy Campaign Director and current Regional Director of Health Services, Galle District, Dr. Prasad Ranavira, Director, Health Services, Colombo District, Dr. Chandra Gajanayaka, and all other medical personnel who are with us today, members of the media, distinguished guests, and my fellow colleagues at Alliance Development Trust. Before I start my address on Act2Prevent, I have two things I would like to share today. Number one is we have a very special guest today, Mr. Roshan Mahanama, who was very gracious to accept our invitation to be here today. Actually, Mr. Mahanama did a very easy thing for me because I thought I had to introduce him, but he has done that for me, so thank you very much, sir, for doing that. For those of you who weren't aware, Mr. Mahanama is involved in 12 different charity trusts. So the fact that he's involved in so many and he has given back to the country is a testament to an individual who has not only contributed to this country in sports, but also through CSR initiatives. So thank you, Mr. Mahanama, for being with us here today. But the second thing that I want to share before I start is my colleague who is comparing today, Mr. Oscar. It's his birthday today, so happy birthday, Oscar. Today marks a very important day in this particular campaign. It's a very significant day because in December of 2023, this entire idea was just on a piece of paper on one of our desks, and to see it in fruition today is honestly a testament to the amazing work that both the government and non-governmental organizations involved in this particular campaign have put together. This is Act2Prevent, raising awareness one step at a time. The anti-leprosy campaign have already introduced themselves and the amazing work that they've been doing for so long. So I thought I'll take a brief moment to introduce Alliance Development Trust. Well, we were formed in 2005 in the aftermath of the tsunami. We were registered as a non-governmental organization in the same year and also under the Companies Act in Sri Lanka. Since then, we have grown to a staff strength of 80 individuals that work tirelessly in various areas of social work outside of healthcare to serve our nation. And over the last so many years, we have impacted the lives of more than 500,000 beneficiaries. I believe that is a modest number. I do believe the number is much higher. And we have impacted them to make necessary changes in their lifestyle, but also to make the necessary change that this country needs. This is ADT's bread and butter. Our end goal is to create change, build resilience, and to help people in this country to transform the nation. We feel that this nation needs transformation, and that is our mandate. And how are we going to achieve this? It's through the 3 pillars that I have highlighted in my slide. We want to empower our communities. We don't want to just support our communities, we want to empower them for the 3 areas of social peace, because if this country needs social peace, it is something that is very important. We want to empower our communities to fight public justice, to give a voice to the voiceless, and also to help them stand on their own feet, to be economically sufficient, and to make a living for themselves, to contribute back to the country, but not just contribute back to the country, but to be a pillar of strength for the society and the communities around them as well. So as I mentioned earlier, healthcare is only one area that the ADT works in. There are 5 areas, as you can see on my slide. So they are sustainable livelihood, creation care and disaster response, child participation and development, peace and reconciliation, and healthcare. And our ethos or our thought process is we need to serve every single citizen in Sri Lanka, regardless of age, race, religion, or economic status. That is what's important to us. So what is A to P? You know, there are some phrases that stand out here. Unconventional methods, complications such as disability, empower, recognize, and intervention. So far, this country has done tremendous work in the sphere of leprosy control activities, and our organization has partnered with the health directorates in the country as well as the anti-leprosy campaign over the past so many years. And the work that has been done is tremendous, but we also need unconventional methods for unconventional times. We need to empower our communities, something that the ADT is very, very particular about. We need to recognize that these unconventional methods are needed and intervention is needed for us to proceed forward. And how are we going to do this? We need to do it through a tool that many Sri Lankan individuals use these days, and that is social media. We hear a lot about social media being something negative, but how can we use such a method or how can we use such a tool to impact and bring positive change in our country? These are our objectives of the campaign. We want to use social media as a tool to promote leprosy awareness. We want to increase the knowledge of leprosy among the general public and break any negative associations around the disease. As all of you know, leprosy is a highly stigmatized disease. If you just spend some time with our partners from Kaveri Kala Mandram, they will be able to share stories with you from their various districts of how stigmatized actually leprosy is. Mr. Amarasinghe is another individual who went through such stigmatization, as he is also a patient who has been cured of leprosy, and that is very important. And we need to create a more empathetic society that will be more accepting of those affected by reducing stigma, encouraging support, and working towards defeating leprosy in our country. We are going to do this. The idea of this campaign is two-phased. Phase 1 is something that we have already completed, which consists of us going to the people. In the areas and in the districts that we work in, our ADT staff were able to get a pulse of what people understand leprosy to be. And if you had seen the videos that were played earlier, some of those videos indicate what kind of knowledge and understanding people currently have of leprosy. So we have been to 6 different districts, Colombo, Gampaha, Kandy, Gaul, and Batticaloa. And we went and we asked them a couple of questions that the anti-leprosy campaign submitted to us and tried to get an understanding of what they knew leprosy to be. And with that knowledge, we were able to give them that awareness by answering the questions after they answered it themselves. So this is the early impact that we are seeing through the Act2Prevent campaign. As I mentioned earlier, we have conducted interviews in 6 different districts and 80 plus people were interviewed. I know that is a small number for the start, but we are hoping to get a more accurate pulse in the coming days. And through our social media promotional messages and our key takeaways, we have reached, as of May 13th, that was yesterday, we only started the pages a couple of weeks ago. These are the main platforms that we have identified for people who use social media to be active on. So that is Facebook, Instagram, YouTube, and the very popular TikTok amongst the younger generation. So we are seeing 3,739 people reached alone only on Instagram, 2,213 people reached alone on Facebook, 3,004 people reached alone on TikTok. YouTube has a lower number, but once we launch today's website, we are hoping to embed our YouTube videos onto the website to increase that number. And this is the main event of the Act2Prevent challenge, or the Act2Prevent campaign, which is a challenge for all. In a few moments, our special dignitaries will also be taking part in this challenge. It is called the Act2Prevent Leprosy Challenge. And what we are going to do is, we are going to, the main objective of this campaign is to detect leprosy patients early in order that they do not persist without being detected and fall into the category of grade 1 or grade 2 disabilities, because leprosy is also a disease that can affect others in a way that it can form disabilities in people. So what we are hoping to do is, through this challenge, is we are hoping to give a numbing sensation to a participant's hand, and after the numbing sensation is given to the participant's hand, they will be required to pick up a toothpick with their thumb and their small finger, and through that challenge, at the end of the challenge, each participant will be sharing key messages to spread awareness to our communities. And how this is going to spread, or how we are hoping this will spread, is each participant will nominate 3 others in their video to participate in the challenge, causing a pyramid-like ripple effect for people to participate, and they will upload that particular challenge and that video to their social media pages. So I conclude my message with a few